Imagine being an international student who's a medical graduate in Ontario, and you're told you will not make the first iteration of residency unless you go back to high school for 2 years. I said it, high school. Take a look.
The new rule applies to international medical graduates, doctors trained outside of Canada who have permanent residency or Canadian citizenship. It now requires them to have attended an accredited Ontario high school for 2 or more years to be eligible for residency positions here. Meanwhile, Ontario is in the middle of a healthcare crisis. According to the Ontario College of Family Physicians, over 2.5 million residents don't have a family doctor, a number experts predict could reach 4 million by next year. The Ministry of Health says they're delivering more opportunities for Ontarians who started their medical education abroad to be able to complete their postgraduate training in Ontario. In a statement, they say in part, to be clear, international medical graduates who do not meet the specified criteria will be eligible, as they currently are, to participate in the second round of the match, alongside remaining Canadian medical graduates and Ontario IMGs. But international medical graduates argue they're already here, and they're trained, tested, and ready to work. All they say that is lacking is opportunity.
So, to be clear, it's not that these foreign doctors that are graduates can't practice at all. It's just that they don't get first dibs, basically. They have to wait for the second iteration, which by that time, the pickings will be very slim. So, at the end of the day, they're just not making it easy for foreign or international med students because they want, as they said, they want to favor Ontarians who, by the way, studied abroad. So, the ones who studied abroad in Ontario can come back and, be able to get first round pick. But the ones who came from other countries and are ready, studied, tested, and ready to work, they have to wait for the second round and hope and pray for the best. Make it make sense. And then, of course, you heard about the health crisis with over 2.5 million Ontarians who cannot find a family doctor. And that's actually true because if you go through looking for a family doctor, what you find mostly is no longer accepting patients, no longer accepting new patients. And you'll see that a lot. And then you heard them say by next year it'll be up to 4 million. Well, the population of Ontario is just over 16,256,000. So imagine by next year, there are 4 million people without a family doctor, and how crazy it's going to be here with, health. Now, just using the statistics of an ER room, for example, in the Niagara region, you can actually go online to see how many people are waiting, what the wait time is to see a doctor, and then based on that, you can decide which hospital you're going to go to. So I just decided to look at what the stats are looking like just today, the day that I'm recording this story. And in the Marada Hospital, the wait time is 5.5 hours, okay? And then they have 42 people waiting, and they're treating 36 people. And then at the Niagara Falls Hospital, the last update shows that it's a 2.5-hour wait time with 10 people waiting. And those are the people that are waiting in the waiting room to see a doctor, and they're treating 18 people. And then at the Welland Hospital, we have another wait time of 2.5 hours and 11 people waiting, and they're treating 12 people. So based on those stats, you can say, okay, I'm going to go to the Welland Hospital because there's not too many people waiting. And that's kind of how a lot of people will gauge where they're going to go. The problem with that is all it takes is one ambulance to come in or one code blue or whatever they call it in the hospital to happen. And all of the ER nurses and doctors have to rush to care for that person. And that 2.5 hours becomes 3 hours, becomes 4 hours. Or you can get there thinking, okay, there's only a few people there and it's only a 2.5-hour wait. And by the time you get there, there's another 10 people there. And then it goes up from 2.5 to 5 hours. There are several people who say that they ended up going home because they just 10 hours later, they're still waiting. And by the way, oftentimes it's only one ER doctor there trying to manage all of this. So the crisis here is insane. And that's just Niagara. We're not talking about other cities, the bigger cities, Toronto, Mississauga, other cities within this province with hospitals. And the wait times are even worse. So we have a crisis. And now they find this is the profession that you're going to start making it more difficult for foreign doctors to be able to practice. And you're saying go back to high school, or you should have have gone to high school for 2 years. They wait until now to make this rule. So a lot of the doctors, the foreign doctors, are saying, please don't do this to us now. We've gone through all of this. We're tested and ready. And again, I say, of all professions, health, that's the one you're going to decide to do this with. When there are so many other jobs that are being scooped up by international students. And there's so much unemployment going on here for even this, the simplest of mid-level jobs or, lower end jobs that people can't get, that students can't get. And this is the one. This is the one. Does that make any common sense to you, brothers and sisters? Because it doesn't to me. But here we go. Here's Ontario for you. And that's why a lot of doctors are leaving Canada and going to practice in the United States or abroad, or going back to their country to practice, because this is nonsense, absolute nonsense. But this is the government here, and this is their decision. So if I were these foreign doctors, I would go take all of your talents elsewhere and practice. There's no reason why they should have to go back to high school for 2 years or be blindsided with it at the 11th hour. Oh, by the way, you should have gone to high school. Meanwhile, the Ontarians who went and studied abroad, they don't have to do that. They get to come back and get first pick. That's Canada for you, eh? Anyway, brothers and sisters, let me know what you think about this. Drop your comments in the chat. Don't forget to like, subscribe, share this content. Also, don't forget to download the African Diaspora News Channel app from your Google or Apple store. You won't be disappointed. Download that app and subscribe to my YouTube channel, Emma Ansah Unfiltered. Until next time, please be safe.